Okay, so Anthem talks about pretty much how it would pretty much save us millions of dollars in healthcare. The thing is, where are we going to use that money in order to, say, buy other medical expenses, antibiotics, and stuff like that, in order to provide for people in the national healthcare system? You have 24 million people that I like math. You have a lot of people that don't have healthcare. So people who are going to be joining a healthcare system, how is there going to be enough resources to provide for these people? Like some cases that do have, some countries that do have a universal healthcare system, it can lead to rationing of medical services, as seen in countries like New Zealand, Australia, France, Canada, and the United Kingdom, even Taiwan. These countries that practice universal healthcare ration services through such as budgeting, controlled distribution, and service restrictions and price settings. So there would be a lot of restrictions if there was a universal healthcare system. And Americans who already have health coverage are satisfied with the existing system. If there are changes in the system, they are afraid that it would be affecting their health coverage, such as losing access to necessary care, changing existing healthcare. It's not easy. Enacting new policies such as a single-payer healthcare can be expensive. The fact is that Americans were not ready. We're clearly opposed to tax increase. That's more money coming from our checks, less money that we would have. The issue pretty much at hand is there are people who can't afford it. We'd be spending a little bit more if there was a national healthcare system. And universal healthcare has a lot of rules and regulations that people have to follow. There is going to be a learning curve, probably a trial and error, or even some technical difficulties, just like Obamacare when it was first launched. So there's no for sure that it is going to work. Implementing a single-payer healthcare system, again, would cause an increase in taxes, such as the system needs to be paid for, basically. The overall cost of the system can be draining on the country and cause larger debts, as we already are in debt. So this would kind of further increase the debt. And again, governments aren't that great at running large systems. So asking the government to run a healthcare system can lead to a lot of problems. To run a healthcare system, there may need to be cuts in other areas that could weaken the government, and those areas compensate for the need for a healthcare system. So, for example, cutting in education, cutting other resources such as the environment, the economy, helping build other resources. So, to introduce a single-payer healthcare system in the United States from scratch would imply not just nationalizing the insurance industry, but also severely reducing payments to hospitals, doctors, and other integral parts of the health industry. Moreover, many people working for politically powerful lobbies would be unemployed or bankrupt, and many others would be faced with whooping pay cuts. Free healthcare system in the United States just seems like a desirable policy, but it would never be politically viable. Thank you.